During this pandemic, we've all been so focused on keeping ourselves safe from COVID-19, we've let other important health concerns kind of fall through the cracks. Screenings like mammograms, our annual physicals, they're all still as important as they were before. And that's why we're talking about all of this today into Your Wellbeing, taking care of your overall health. Dr. Patrick Wright, Medical Director of Cone Health's Mobile Health Program, and Dr. Matt Manning, Chief of Oncology, join us today to discuss your health. So during COVID-19, a lot of folks put off getting annual physicals and screenings. Tonight, we're going to talk about those physicals, the screenings, what they look like after COVID, and when to get that, and what options are available at Cone Health on Wheels. So Dr. Wright, just how important are the annual physicals? I think some people think, I feel fine, I don't really need to go to the doctor right now.
They are very important, Tanya, specifically when you see the provider. In addition to the history and physical taken, you'll be screened for high blood pressure, diabetes, and other chronic health conditions, including blood work that may be obtained, urine samples. Many of these conditions are very asymptomatic in the early stages, and that is why it's very important. In addition to that, preventive exams can be ordered for screenings, and as well, important vaccines can be given as well. And if you're a Medicare patient, there are annual Medicare wellness exams that have very specific elements that are often without a copay for the Medicare patient. And these are all available in our mobile health program that we'll talk about.
And you wouldn't want to let more than a year go by without getting those types of markers.
That's right, because many chronic health conditions can slip up, if you will, in a period of a year. For example, this past year and a half, we have seen many patients come in who did not know they had diabetes or hypertension, may have been exacerbated even by the stress of the past year and a half, or even the virus itself. And in that year and a half period of time, things changed for them. So that's why an annual checkup with a provider becomes very important.
Okay, so now let's go to some of the scheduled procedures. So Dr. Manning, during the pandemic, a lot of people just kind of put off the mammograms, they put off the colonoscopies because they were a little, worried about things. How concerned should we be now that there are some undiagnosed conditions that are out there because we have not had these screenings?
Yeah, that's a good point. We actually stopped providing screenings for breast cancer and colorectal cancer in March and April of 2020. And the American Cancer Society estimates that 22 million cancer screening tests were missed in 2020. Cancer screening is a very important tool in beating cancer. It's estimated that we save 12,000 women from breast cancer every year with breast cancer screening, and we can save as many as 33,000 colorectal cancer patients. Within the Cone Health Network, we diagnose between 80 and 100 new breast cancers a month in our mammogram units, and it's time to get back to that. So if you have a loved one who missed an exam in 2020, please encourage them to come back.
Just hear that, 80 to 100 a month. Those are 80 to 100 people whose families are now dealing with all of this. So you'd want to get that sooner rather than later. All right, Dr. Wright, let's talk about when people should get their cholesterol, their blood sugar, all of that checked, eye screenings.
Yes, so for cholesterol, anyone over age 20 should have their cholesterol checked at least every 4 to 6 years, depending upon your risk factors. If you have cardiovascular disease or diabetes pre-existing, it may need to be checked more often. Even children and adolescents who have diabetes and obesity may have their cholesterol checked by their pediatrician. As far as blood sugar, that's another thing. You can be completely asymptomatic. And so we recommend individuals over 45 should be checked every 3 years at a minimum. Blood sugars may need to be checked more often if you have a pre-existing risk factor like obesity or a family history. And then as far as eye screenings are concerned, your pediatrician may check your child's eye at age 6 months, and then tested again if there's a concern, and then at school entry for sure getting another screening. From 18 and on up to 60, you should have your eye exam at least comprehensively done every 2 years, 61 and over about every year by a competent optometrist or ophthalmologist.
Yeah, and maybe with all the screen time we've had in the last year, we all need to go back there just to double check. All right, Dr. Manning, what are the recommendations for the cancer screenings?
So the American Cancer Society recommends breast cancer screening begin at age 40 for women and mammography begin annually by no later than age 45. For colon and rectal cancer screening, the recommendation is to begin screening at age 45 if you're an average risk patient. And screening for colon cancer can occur through tests that test the stool for signs of cancer through a stool sample or through a visual inspection through colonoscopy. Cervical cancer screening should start at age 25 with an HPV test every 5 years or a pap smear every 3 years. And we now have lung cancer screening, which is helping us to identify early lung cancers that starts at age 55 for smokers. And prostate cancer screening, most men should begin talking to their doctor about the importance of prostate cancer screening and whether it's right for them at age 50 or 45 if they're African American or have a family history.
Okay, so we've given you kind of like in a nutshell about the screenings and the procedures that need to be done. We don't want you to go anywhere because the doctors are going to be right back with one more segment.